Good day to everyone. Welcome to our YouTube channel of Trishla Foundation. Trishla Foundation is fully dedicated trust to children with cerebral palsy and their family. Our motive is to increase the awareness among the family and caretaker of the children with cerebral palsy so that they should do their best to take their child to the extreme whatever possible for them. Lots of modalities is available in the market places, and everyone is trying their best to give the best results. But you know that cerebral palsy is going to have a lifelong problem. It is a very difficult problem, and whenever cerebral palsy affect any children, the whole family is going to affected. So we should be aware about each and every modalities of treatment so that best modalities of treatment can be given to the children. At this time, you know that stem cell therapy is propagating since 2 decades, but till now no scientific basis has been given and no scientific body has given approval for the use of stem cell in the cerebral palsy. It is still under the research process. So why this happened, what are the fact is available with us, we should know. So I will try to explore everything what is truth is available about this stem cell therapy in cerebral palsy. Cerebral palsy is a condition that affects not only a person but whole family for a long time, and every family want a cure for that child. Whenever we know that cerebral palsy is affecting your child, then you are trying every modalities of treatment so that your child can be much better. But you know that brain damage is permanent, cannot be cured with present available technique. So in brain, as we know that neuron cells are responsible for all signal and control of the body function. These are very vulnerable cells. Another cell called oligodendrocyte may be covering only those neurons with fat called myelins. These oligodendrocytes which cover the neurons die in cerebral palsy, especially in case of hypoxic ischemic cerebral palsy, which main cause of the cerebral palsy in the children. Once this cell dies, unprotected neurons also die eventually. If we can manage to hold this myelin cell, so from preventing from the dying, so that then we can save the neuron. But till now it is not possible. Still research is going on stem cell technique to regenerate this myelin cell and neuron cell as well. People are using stem cell technique at some center in some part of the world, especially in our countries and lots more countries like China, Europe, USA, but not under the scientific body controls. We need to understand before deciding to choose it as a treatment option. What is the stem cell? How to use it? What are the side effects? We will discuss lots about all those things in these lectures. Stem cells are multipotent cells that exist in the both developing and adult tissues. Stem cells have potential to build and recovery every tissue and organ in the body due to their unique proliferative, differentiation and self-renewal properties. So stem cell can be used, and it is being used in many other places. Human stem cells are essential for growth and maintenance of our organ, bones and system that is normally available in our bodies. Stem cells provide therapeutic effect which improve physical development by regenerating damaged cell to assist in the organ recovery. Many types of stem cells are being used: adult stem cell, embryonic stem cell, pluripotent stem cells. What is the adult stem cell is? Adult stem cell is undifferentiated cell found in specific differentiated tissues like bone, muscle, neuron, heart, GI, whatever places. These cells are renew themselves. They can generate new cells that can replenish dead or damaged tissue whichever places they are present. Adult stem cell may not be able to manipulate it to produce all cell type. Adult stem cells are being used to produce their main cells where these are available. They cannot replace to other cells. They cannot form the other cell available in the bodies. Use of stem cell in treating disease is limited. It is only stem cell approved by the Food and Drug Organization of the America, FDA body. What are the type of adult stem cells is available? First is hematopoietic stem cell, blood stem cell, that is used by the blood cancer. Mesenchymal stem cell, neural stem cell, epithelial stem cell, and skin stem cell. All these are stem cells are available, they are being used. Other type of cell is embryonic stem cell. Embryonic stem cell are derived from the inner cell mass of an embryo that has been fertilized in vitro in body and research donated for the research purposes following informed consent, because that cannot be used, that cannot be regenerated outside the body. They have to regenerate in the body of someone else, that these cells can be donated so that it can be used in other person for this special purpose. They are pluripotent cell that can be differentiated in almost any type of cell present in the body. That is a true stem cell, but it is very difficult to use it because there is lots of legal issues are available. As we begin to understand this developmental process, we may able to apply them to stem cell grown in vitro and potentially regrow such cell as a nerve, skin, intestine, liver for transplantation. But ethical and legal issues arise, so it limits its use in clinical practice and research. Third one is now it is being very commonly used, that is the induced pluripotent stem cells. Induced pluripotent stem cell are stem cell that are created in the laboratory, happy medium between the adult stem cell and embryonic stem cell, that is in between the adult stem cell and embryonic stem cells. iPSC are created through introduction of embryonic genes into somatic cells. But you are taking the embryonic genes and inserting it in somatic cells. This causes it to revert back to stem cell like states. That is a middle state and that can be used. These cells are like embryonic cell are also considered very important pluripotent cell, which was discovered in 2007. This method of genetic reprogramming to create embryonic like cell is novel, and it's many more years of research before use in clinical practice. So it is also need many years of research process, so that can be openly used in the clinical practice for patients affected with different problems. Now we wanted to know how stem cells are working. Stem cell can be taken from the body or embryonic cells line injected at required site, and whenever they are injected at the required site, they will multiply, take the function where it was injected. How it worked? It inhibits the inflammatory cascades, it inhibits the apoptosis, it created the cell recruitment, new cell regeneration at this site, stimulation of angiogenesis, that formation of the new vessels at the site where the cell has to be found, and differentiation into different form of the cell which is required for the body where there was damage. New technology improvement make it possible for the skin cell to be taken from the patient and turned into the exact cell needed to repair injured tissues, getting right of the need for the tissue donor, waiting list and anti-injection drugs. But it will take times. Till now, all over the world, blood and lymph diseases are the most common diseases that have been benefited from the stem cell treatment, and this type of the treatment is approved by different scientific body only for the blood and lymph diseases. In principle, any idea regarding stem cell therapy should be assessed using comprehensive study, in vitro, that means in body, in vivo, that means outside the body, in the lab, in the test tubes, before a clinical trial is considered, and result of this study should be provided, proved by the competent authorities. Clinical trial study are not simple one. It is in 4 stages one. In each phase, the purpose of study, number of participants, follow-up duration may differ. It takes years together to come into the clinical practice. It has to be followed by the exact protocol what were given by the scientific and authorities. A new phase of clinical trial cannot be started unless the results of completed phases have been reviewed by the competent authority. In order to that, certified results of completed phases are valid for authorization of start a new phase of the clinical trial. That means one stage has been completed. Then for start of the second stage of the trial, that approval body has to give it consent so that second trial can be started. Then we can start this trial. That means it is a very, very long process. For this purpose, at the end of each phase of clinical trial study, competent authority evaluate whether new drug is safe, new technique is safe, efficient, effective for treatment of the target diseases. Then new phase can be started. Which body can give the authority to start this research process to use of stem cell in the clinical practices? In USA, it is Food and Drug Administration, FDA of the United States. In Europe, that is European Medicine Agencies. In India, it is the ICMR body that give consent, that give approval for the use of specific drug, medical technique, stem cell in the clinical practice. No other authorities can give the approval of the use in clinical practice. Now, after seeing all those things, we have to know what are the side effects. If there is any side effect of the use of stem cell, as there is lots of side effect is there. Side effect can range from the minor element to severe issues like mucositis, then inflammation of the mouth cavity, nausea, vomiting, infection, bleeding can occur, reaction, anaphylactic reaction, and stem cell failure can be occur. That can also cause, if side effect is can be too much, organ damage can occur, irreversible damage to the brain, eye, cataract, and cancer can also occur with wrong use of stem cell in the human body. Immune reaction can be occur. Tumor formation, teratoma can form because this pluripotent cell can multiply very rapidly and there is no use to the body, then teratoma can form. We know oncology diseases that can block the vessels. Genomic instability after long-term explanation. Genetic diseases can appear. Stem cell migration to the inappropriate region of the body that can create different structure in the body. Once stem cell are put in, they can never be removed. So that you should be very, very cautious. You should know what are the side effects, how they are to be used. Now, I am going to talk about the key point. The transplanting stem cell into the brain could support or replace brain tissues during the process of white matter damage in cerebral palsy. Animal model used in the research on cerebral palsy have shown that many types of stem cell can be used to reduce damage and return motor function after brain injuries. Potential role of stem cell in treatment of cerebral palsy has not been fully studied, and it will take many years before safe and effective treatment and to reach clinic. That has been quoted by the DMCN, that is a journal, in 2016. Rehabilitation and orthopedic surgery, pharmacology are the current method of care. That is also quoted in the 2016. That stem cell therapy is not current mode of treatment. That is only supportive, but still in the research process. But in the world, there's countless clinics around the world are using stem cell transplantation in cerebral palsy. However, these clinics have not yet shown any scientific evidence that their procedure provide any effect beyond placebo effect and are normal developments. Till now, we have seen in last 25 years, hundreds of children who have undergone the stem cell therapy, but we have not seen any improvement in their children. Only that placebo effect. And parents are not ready to talk about the stem cell use because they have lost the lakhs of money and there is no changes in the body. And we've also seen few children where the problem has increased to many fold. So you should be very, very cautious. It is approved that still research is going on. Stem cell tourism has flourished over the year due to lack of transparency, unfair media promotion, but many of these clinics are unregulated, lack legal affiliation, accountability, and use technology without a solid scientific basis. Only 3 years back, ISMR has a given guideline so that no clinic can use stem cell therapy openly in the clinical practice to the autism and cerebral palsy persons. It has been given only 3 years back, but it was used since 2 decades. Individuals utilizing such clinic expose themselves to lack of success, exclusion from the legitimate trial, false hope they are giving, complication that's coming to the children, and financial hardship. Lots of families are spending lakhs of money on the stem cell, but there's no use. There is no proof that any stem cell therapy offered by the stem cell clinic is effective or safe. Unlike FDA approved procedure, which are subject to years of rigorous trial, unapprovable treatments marketed directly to the patient are developed and performed with little oversights. Very, very difficult to say. Almost all researchers in the field of stem cell therapy believe that despite stem cell having great potential to treat the diseases through intrinsic potential, unproven stem cell therapy have not been shown to safe or effective and may be accomplished by very, very rare serious health risk. To minimize possible side effect, every new stem cell product should be approved by the clinical marketing only after the phase 1 to 4 clinical trial successfully. Then it should be used in the market, but still it is being used. I have lots of paper with me. That one question was asked in the ministry in 2023, last year 21st July, from the Ministry of Health and Family Welfare. He has also given the answer that Ethics Medical Registration Board of National Medical Commission has issued recommendation that use of stem cell therapy in treating patients with autism spectrum disorder is not recommended. It is clearly given by the answer given in the during the discussion in the Central Ministry. Association of Child Neurology India also has given this letter February 2023. Stem cell therapy is not recommended as treatment for autism in clinical practice. It is a professional misconduct, and cerebral palsy is similar to the autism spectrum disorder. Economic Times, this link came also last year. The highest concentration of stem cell therapy clinic in the US, Mexico, China, and people are traveling too far. Why to get this treatment, leading to phenomenon known as stem cell tourism. They have given lots of detail about the research, whatever they have got in the market. They have given that this stem cell therapy given a very, very large side effect and still very early stage. So it should not be widely used and not shown as a miracle treatment for all diseases like cerebral palsy and autism disorders. This was the this thing. Other ISMR has given the guideline how this stem cell therapy treatment should be researched through the government agency. They given different guideline. And unethical promotion with false claim, misleading advertisement have been widely used. That should be banned. That is should be taken as a professional misconduct by ICMR. It's also given in the use of any type of stem cell therapy should be restricted to clinical trial with necessary approval from the regulatory authority in the India. One article that was published by the BBC Future, they've given that clinic claim that expensive stem cell therapy can help patients with dementia, autism, cerebral palsy, multiple sclerosis, and crowdfunding are being done companion to pay for the treatment, and it is very, very common. But on the research they have found that one person who is giving the stem cell therapy, they become almost blind. When I wake up in the morning, one of the hardest thing is opening my eye and seeing that everything is still dark. one side effect. Another history they have given that 17 patients were hospitalized over the past year after the use of stem cell. They have got the series of bacterial infection. One patient developed spinal cord tumor. 9-year-old boy developed the multiple brain and spinal cord tumor following stem cell transplant in the cerebral palsy. That is, he described the research as a premature that should not be used, and they have given that Journal of American Medical Association study that 43.6% companion carried statement that were definitive or certain about effectiveness treatment. It is not too difficult to trace this oversighted claim back to same clinic that use token of scientific legitimacy. That is, legal approval is not there. No peer-reviewed article or publication is there. The all annoyed and out of pocket and con. Lots of financial burden are coming to the families. Even patient लिखे हैं non-contained stem cell or a single live cell or any kind. Now serious questions are coming that still their stem cell are being used. They can be used in the clinical practice. In the paper also, medical commission, National Medical Commission has banned the use of stem cell therapy to treat the autism, cerebral palsy and other diseases that are degenerative disease in the children. National Medical Commission has given the guideline, and along with Indian Academy of Cerebral Palsy has also given the consent that this stem cell therapy should not be used till it's proven in the cerebral palsy or autism disorder. So this was the results research what I have talked to you. So the parents, our caretaker should be very, very careful about the use of treatment which are still under the research process. Whatever the facilities available, the occupational therapy, physical therapy, yoga, bracing, assistive devices, surgical intervention are the modalities of treatment for the cerebral palsy. If you are really wanted to treat your children with cerebral palsy to maximum impact, you should start giving training to the child so that they can train in the activities of daily life. Whatever activity they are not able to, they can do it. If they have abnormal disorders, abnormal movements, that should be controlled by the powder massage, different technique, whatever they can be given. And their muscle are weak, that should be strengthened. So, stem cell therapy, general exercises program, lots of homeopathy, ayurvedic, allopathic treatments are of no use in the cerebral palsy. I have given the references is there. Anyone can go there and they check whatever the new thing is available about the cerebral palsy. Lots of site is also given in the PPT, so that you can go there, international level, whatever research are going on the cerebral palsy. So be careful, be watchful, and here whatever lecture is uploaded on this YouTube channel, please go there, subscribe them, and here look all those information, whatever about the truth about the cerebral palsy is there. Thank you for hearing this lecture.